The topic of our discussion today is intrapartum care in hypertensive disorder of pregnancy. According to the NICE guideline about hypertension in pregnancy, it is written that give advice and treatment to the woman with hypertensive disorder in pregnancy in line with the NICE guideline on the intrapartum care. So about the intrapartum care, we have a separate NICE guideline, okay, unless there are recommendation on this guideline on the same topic, okay. And about the chronic hypertension, it is written that give women with the chronic hypertension advice and care in line with the NICE guideline. And blood pressure monitoring, about the blood pressure monitoring, certain things have been written, okay. So what is the specific advice about the blood pressure during labor? During labor, check blood pressure hourly, okay. We have to check blood pressure hourly in women with hypertension and every 15 to 30 minutes until the blood pressure is less than 160 by 110. So if the blood pressure is crossing the line of 160 by 110, then we have to check it more frequently, like 15 to 30 minutes, okay. If it comes down 160 by 110, then we will do hourly blood pressure. And continued use of antenatal antihypertensive treatment during the labor, okay. During labor we will use the same like labetalol as the first line, okay. And if the blood pressure is high, then we have to consider IV dose of labetalol, or labetalol is not available, then we can go for other drugs as well. Now what about hematological and biochemical monitoring, okay. Not only we will do a blood pressure monitoring, but we will also do hematological and biochemical monitoring as well, okay. So about this, it's written that we have to use the same criteria which we used in the antenatal period, okay. In the antenatal periods we use a criteria of doing hematological and biochemical test, okay. So you will use the same criteria, okay. Even if regional analgesia is being considered, we will use the same hematological and biochemical criteria. Now what about the care during epidural analgesia, okay. Care during epidural analgesia, okay. So about this, it's written that do not preload the women who have pre-eclampsia with intravenous fluid before establishing low dose epidural analgesia or combined spiral epidural analgesia. So we don't have to preload the woman, okay. Do not preload, that is what we have to remember in this. Now what advice we have to give during this second stage, okay. So management in second stage, we have to discuss this in a separate way, okay, because second stage management is a bit different. Do not routinely limit the duration of the second stage of the labor in women with the controlled hypertension. So if the woman has got controlled hypertension, then do not limit the duration of second stage of the woman if the blood pressure is well controlled. Secondly, consider operative vaginal delivery or assisted vaginal delivery in the second stage of the labor with severe hypertension whose hypertension has not been responded to initial treatment, okay. If the blood pressure is controlled, then we will not go for operative vaginal delivery or assisted vaginal delivery. But if the BP is not controlled, if the BP is uncontrolled, okay, if the initial treatment is not effective, then we can go for operative vaginal delivery or assisted vaginal delivery in order to shorten the second stage of the labor. Otherwise, in a well controlled hypertension, we will not in routine go for reducing the second stage of the labor. So these are certain points which we studied in the intrapartum care of the woman with hypertension, okay. First of all, advice and treatment according to the NICE guideline. Blood pressure monitoring during labor should be hourly, okay. But if the blood pressure goes above 160 by 110, then every 15 to 30 minutes. Hematological investigations and biochemical investigation should be the same as we did in the antenatal care. Means we will not do frequent hematological and biochemical investigation until and unless we need them, okay. Now care during epidural analgesia. If the patient has got epidural analgesia, then we will not preload the woman, okay, as I have written. And in the second stage of labor, in case of the controlled hypertension, we will not go for reducing the second stage, okay. But if the blood pressure is not responding to the initial treatment, and if we think that it is uncontrolled, then we can go for operative vaginal delivery or assisted vaginal delivery. So these are some important points in the intrapartum care of women with the hypertension pregnancy.